Okay, so I hope everybody joined. We have the use group on screen. So just for an introduction of the meeting, well, first of all, if I didn't already said it, welcome everybody and thank you all for joining. It's nice to have you all here, despite the condition we have now. I'll try to make this meeting as comfortable as possible. Don't be scared to share your reaction and question in the chat box. We will have different parts in this meeting. So as the first part, we will present the activity of the use group and who we are. We should have also an intervention of Marco from the SK board to present the activities of FK as a whole. And then the CEO things will start. We will present what we did with the iBridge project. So the one you can know as the transition project that we did this year and we talked about last year already. And after this kind of throwback of the activity of the past year, we will have a small break. And then we will keep on with the future activities. So first with the elections of the new board, then with the new project that we will focus on, and eventually with a workshop that we will do together to leave you the floor about the education project. So Antonella, if you can go to the next slide, so we can present the housekeeping rules of the meeting. So it's basically what I write you in the mails already. So we have the elections. You should have received a token and a link will be published. So you will have to log in through the link with your token. Your token is private. You can only disclose it with your fellow delegates if you have one. And it's only one board per country. Everything will be explained when it's time to vote. You should know also that the meeting is recorded. So you will be able to look at the replay afterward. We will share it. We will share it with you. We might also share it on our social media channels. So if you have any problem with it of disclosure, you can reach out to us before we share it. I also ask you to switch off the microphone and camera. And Nimrod, if you can switch off your camera to have a better network, to have only the speakers on screen, so it would be more convenient for everybody.
Okay.
And if you can just switch off the camera so it doesn't mess with the network and doesn't overload the slides. And if you have any reaction or question, you are free to share it in the chat box. And if you happen to be disconnected, I think the easiest way is to leave the meeting and join back and refresh your browser. But hopefully this won't happen. Next slide, Antonella, please. So a quick presentation of the use group. So you have the faces on camera. Unfortunately, Natalia will join late, so she's not there yet. But this is the 7 people of the use group. We work with an election every year. Every member is elected for 2 years. So currently I am the leader. This is me speaking on the left. Then we have 2 newcomers from last year, Amaranta Cantero. Hi, Ami.
Hello.
Olga from Serbia.
Hello.
As you can see up there. And for the people that were there already last year, so the first one is Selena. Hi, Selena.
Hi.
We have Simo as well. And Olga. So Simo and Olga are basically the one you see posting everything on social media. So you might have heard of them already. And Natalia also from Slovakia that will join a little bit later, and you will see during the workshop. Okay, if we can go on. So this is just an overview of the activities we had for the past year. So of course the main event is the DFK Youth Meeting, the meeting we are having right now. So the EYM is a huge deal of work even when it's online. And beside that, we also have a seat in the FK board as a youth group to make sure that the young people have their voice heard. So I do participate as a leader, but legitimately everybody can participate in the youth group to the FK board meeting. And we also hold a midterm youth group meeting usually in Brussels. It's the picture that you can see on the top, where we gather the people elected to discuss about the activity and the strategy of the end of the term, so the few next months. So it's a very important meeting as well. And what we also do sometimes, it's kind of advisory with the pharmaceutical company, like we did this year in Brussels with Janssen. So it's the picture you can see at the bottom. So it's demands that come from the pharmaceutical companies directly to us. So it's allow us to bring the patient perspective as well into their development. And as a matter of communication, we share articles on the in the FK magazine. So I don't know if any of you have read an FK magazine already or know that it exists. Well, if you haven't, I strongly encourage you to take a look at it. It's a very well done, and it's also a good way to have news of the activities of FK, and not only the youth group, but the FK members as a whole. And what we also do, because we are young and we need to target young people, is to be active on social media, of course, to share our activities with our community. So we are active on Facebook regularly, and since this winter, we also have an Instagram page. So feel free to go like it if you haven't done it yet. And as you may know, also we focus on one particular project every year. So as we discussed during last EYM, for this year it was the project about transitions that we then renamed iBridge, and we will talk about it a bit later before the break today. And we will also launch a new project for the next year. This one will be about education, and we will have a full presentation and workshop about it. So I will spare the detail for now. Okay, so that was an overview of the FK, and I think you can, Antonella, go on with the Marco presentation. I see that Marco has joined, and I will keep the presentation about our bridge for a bit later. So now let's give the floor to Marco to present the activities of the FK board.
Should we switch off our cameras,
Yeah,
Martin, to see Marco?
To switch off the camera, so you can leave the floor to Marco.
Hi, everyone. I hope you can hear me. This is an online event, so we usually say hopefully the internet will serve us and we will have a stable connection. Welcome everyone also from my side. My name is Marko Perovic. I am member of the FK board. I think I know most of you, and we have also spoken. We met, some of us at least met last year in Brussels during the youth group meeting. This morning I was traveling for a mini holiday, and I kind of remembered how it was last year, and I know I was also traveling last minute to Brussels to meet you all, and I kind of miss this physical contact, and I'm sure we all do. And it is indeed, you know, we are all physical people. And I think we are also missing the opportunity to see each other, to talk face to face to each other. And I think a large part of youth meetings and of meetings in general is to kind of get the feeling or the sense of the other person. and also be able to share and listen and talk and also think about us and what we do. But I also know that this COVID situation will go, definitely, one way or the other. We know that during time we will have a response that is better and more effective, and over time, hopefully, we will go back, or we will go to a new normal. And certainly the situation will change, but hopefully we will see each other soon, and hopefully already next year. So anyway, my job here is to give you a presentation of what EFCA has been doing in the past year, and also maybe give you some background information that you can use to discuss your work during the day and see how and in what way you can also contribute to the EFCA's general mission, which is to support the lives of people who live with IBD, and in broader terms, anyone who is affected by IBD. So their families of those who live with IBD, but also their friends and close ones. So I am ready for a presentation. I see that our presentation is here. You probably know that in 2019 we prepared and our General Assembly adopted the new EFCA strategy. And before I go there, I just need to know if everyone can hear me, because I didn't ask that. So in case you cannot hear us, I believe that Ant or someone in EFCA or you guys can also indicate and write in your chat box if you have not been able to follow or if you lose me. Hopefully my internet connection is still stable. So I will also keep an eye on the chat box in case you have any questions. Thank you, Pantelis, very much appreciated to see that it's still working well. Anyway, so if you have any questions, if you have any comments, please do comment. I will keep an eye on the chat box, and Martin and the other members of the board of the youth group will also be able to follow. I will start by saying that we have, I would say, 5 important pillars that keep the strategic approach. This is networking, awareness raising, advocacy, empowerment, and then solidarity as a cross-cutting principle. I think this is very important when we talk about any activities that we do or that we plan to do. I also think that we also need to think how we do it. So for us, partnerships and participating and working closely with other communities is very important. And I think in a broader sense, IBD community works very closely with medical societies, with academia, with researchers, with government. So there's a lot of partners with whom we cooperate and form and maintain partnerships to fight IBD and fight for better life of those who are affected by IBD. Awareness raising, on the other hand, is and the advocacy work at the same time are extremely important, because we do face so many challenges that impede or limit our opportunities as people who live with IBD. And then it comes natural that you want others to know what you're faced with, and you want others to understand your issues. And why is that? It's simply because this is the start for your fight. This is how you start your fight for improvement. You raise awareness among people on your problems, and then you fight for them. I think that people who live with IBD often need support to better cope with their life, to better fight for their rights, to better protect and protect access to different services, to medical services, to work, to education. For that, we also need empowerment. Empowerment for us is a way to strengthen our skills, our capacities, our knowledge to better participate in this joint endeavor towards towards supporting better life of people who live with IBD. And then solidarity, I think this is the basic premise. I think it's also the overarching principle for our work, which means that we work together, and only together we can be stronger. And this is what constitutes an IBD community. And I also think we support each other, because solidarity is also about supporting, be that individual support, like we all do. We share advice, we talk about our illness, we talk about our experiences, we give a helping hand when others are in need. But we also support each other among the associations, among the groups, because this support then brings together several groups into a network of solidarity too. So let's go on. I will be quick here, because I just wanted to kind of remind the group, in case you have not been able to follow on what the EFCA, as the European Federation of Crohn Colitis Associations, has been doing in the past, in case you have not really seen the latest information about our work. And you are also part of this work, because the youth group is part of EFCA. It's naturally one of the most important elements of EFCA. So in the previous year, we have held our General Assembly. So some of you might have also participated or saw a recording from the General Assembly that took place at the end of May. Before that, in February this year, just before the COVID crisis, we held a symposium, an event during the ECHO Congress. You know that ECHO, the European Crohn and Colitis Medical Association, holds their annual congresses in February in Vienna, and then EFCA held a specific meeting with doctors, with researchers, with member associations, to discuss the potentials and the opportunities related to big data, and how the better data collection can improve the work on digital health also. Over the period of COVID, because situation has significantly changed for all of us, and I think we have all seen this shift from physical contact and physical meetings into more online events. We held so far 2 patient talks. These EFCA patient talks are short and brief online meetings where we discuss issues pertaining to the COVID and issues that have risen as a result of COVID crisis. We have had 2 such meetings. We held 2 EFCA patient talks online. One was in late June, about the medical supplies, the availability and accessibility of medicines for people living with IBD in the time of COVID, and how medical supplies are impacted by that. And then the second EFCA patient talks was discussing the impact of COVID on our mental health and well-being. So the second EFCA patient talk was held somewhere mid-July, so last month. And we talked about what it really means for us in terms of what does isolation mean for IBD, because we have all experienced isolation at some point in our life as a result of the illness. But how do we experience this new isolation influenced by the lockdowns, by the mobility restrictions? And also, we talked about what happens when COVID is finished, and what is this new normality that we will be stepping into, and how do you cope with the new normality, and what is the new normality to start with, and when the COVID crisis, at least as we now see see it is over. Then looking ahead, we will be holding our regular and traditional EFKA Academy. This year also, you know that EFKA Academy is an EFKA kind of certified or EFKA designed course that provides capacity building and empowerment to IBD patient advocates. This year's EFKA Academy will be dealing with training on clinical trials, participation in clinical trials, what they are, what do they encompass, and what participation in these clinical trials mean. Obviously, it will be held online. And this will be also announced to, the exact dates, I think, have not yet been announced, but one of these days, the associations, the member associations will receive further details and invites for that. For the last couple of years, for a long time now, we have had World IBD Day events. They are usually held around World IBD Day, around 20th of May. Every year, this has been a landmark event, and around the world, we see many locations lit in purple color in recognition of this important day. But over the past, in the past year, 2019 in general was devoted to IBD and work. And this is in accordance with the EFKA strategy adopted last year. And this year's topic, next year's topic will be IBD and psychosocial health, and psychosocial support also. In recognition of the fact that IBD does affect psychosocial context of a person who lives with this illness. So this means that our activities will also be focused around this topic, and every year this topic is slightly different so that we can shed more light into areas in which IBD life is affected. And then there is a project that records the experience and the perception on the quality of life of those people who live with perennial fistula. I hear a background noise. I don't know if this is me. No, Michele. Okay. So let's go on. Perfect. This I'll just walk quickly through this to say these are other important initiatives we have been implementing and we are still implementing this year. As you know, we always have surveys where we collect again experiences and perceptions of people who live with IBD so that we can have an informed position and so that we can raise awareness of general population and general public about the issues IBD patients or people who live with IBD rather are faced as part of the upcoming events. We will have a survey on couples with IBD and pregnancy. EFKA is continuously collecting and updating information about the availability of medicines as well as new and innovative medicines which are coming up in the world market. We hope we will have more information about the availability of medicines across Europe, and this will also be a comprehensive snapshot that you can have a look at and see, for example, where your country is located in this broader picture and understand what is the situation with medicines across Europe and beyond. As usual, we produce a magazine, which is, I think, a cornerstone of our communication activities. The youth group has contributed before. We we believe and we hope this will continue, so that we can also cover topics and areas of interest of young people in Europe. And I think contributions from the youth group are extremely important. And then we have a series of other projects. I would maybe pick out Horizon 2020 projects, which have been prepared, and they really took a lot of effort and investment from EFCA to prepare. I think they are particularly important because they imply or they foresee partnership of EFCA and academic community and researchers with support and funding from European institutions, which is a part of where EFCA funding comes from. Let's go on. So just a few words about our General Assembly held on the 30th of May this year. So we are now 41 countries, mostly in Europe, but also beyond Europe in other continents. You know that very often we have observer countries which are not yet part of the EFCA network, which are not formally members of the EFCA family, but are close friends until they do become and they are accepted into EFCA membership. This year, Latvia has been approved as a full member, and Trinidad and Tobago has been approved as a new associate member. This is saying that the EFCA family is growing also beyond European borders or also beyond European continent, because I think that communities around the world are now recognizing this synergetic potential that EFCA is providing, and this network of national member associations that are really, really strong and supportive among each other. And when I say member associations, I mean also you guys, because you come from national associations. I come from a national association. So let's go on. Indeed, there are also challenges. I mean, we are faced with a lot of operational issues. We are faced with the fact that, unlike before, we cannot travel, so we cannot meet in person. And we have to resort more and more to online communication. Online communication has its advantages. It also has its disadvantages. I think we all prefer to see each other once in a while, even though it implies that we have to travel, we have to take days off, but it does bring this special value. Unfortunately, we had to postpone some of our meetings after March this year, and thus, but certainly for the first time in EFCA history, we held a General Assembly online. It was a real challenge for everyone. I think technically it was really, really complex. And I think a great thank you to the EFCA office and our IT staff who had really made this happen. I think in a similar way, this event takes a lot of investment to organize. I think it also, the COVID has also changed and posed issues and difficulties for associations at your national level, because you cannot meet people. People are usually very isolated. They shield from COVID. They change their life habits. They also see new problems coming up, and the associations need to keep up with these new challenges. So how do you maintain this communication with your membership? How do you communicate with individuals who are very vulnerable? How do you identify the new issues, and how do you find the answers, and what do you do to keep abreast of the new developments? How do you know whether a specific clinic will change if an IBD, for example, unit will change the way they operate on the account of some COVID priorities and urgencies? So I think it also this COVID situation also requires a lot of work and change in the way many member associations operate. And let's go on. I think we're ready to move on. So I think in line or kind of based on what I just said before, that I think the youth group also needs to think about, or should be thinking about, what you as a group of young people who live with IBD and who also have this energy to bring about change and maybe generate some new activities. I think you can also think about, you can first of all join this conversation on the COVID and IBD. Whenever you have a new idea, I think we are more than welcome to discuss them and integrate them into our work plan for the EFCA network. I think you can also work more very directly in your national associations and then step in and be active in collecting information, in organizing online discussions, in talking and to other people, in even maybe better networking virtually and online between yourselves and other IBD people who might be isolated additionally due to COVID. And as I was saying, since World IBD Day is the most visible and global cornerstone event of the year, we always join kind of forces on that day to show to the public and to the world how many of us are there. So we go on, because I see that my time is slightly running out. So I will be quick again here, hopefully, and I hope you can follow. We carried out, when I say we, I mean EFCA as a network. In fact, very many national associations carried out a COVID-19 survey to show what people who live with IBD feel about the COVID crisis and what their perceptions and experiences are. And I think that, you know, there is some data that is quite expected and does not really tell us, only confirms what we already hypothesized. For example, 85% of patients are afraid of getting infected, and I think somewhere we all understand the risk and the danger of COVID, not only in terms of one's personal health, but also in terms of risks COVID presents for the health systems. At least half of our community feels social isolation. I mean, these are the responses of I think around 3,000 respondents. So half of them felt social isolation, and the survey was held in April. So I think it was held in the peak of the COVID crisis. 98%, which means basically everyone, had reduced their daily habits. And I think this is an important data, because deep down psychologically it tells us that we have all changed the way we live day in and day out, and it does have some implications. We can talk about also what implications they are, but the way we live our daily lives has been affected by COVID. 3/4 of people who live with IBD are afraid to go to hospital for their regular IBD treatments. 60% think the stress will make their IBD worse. So they do recognize that they feel stressed, anxious, and are concerned that this state of psychological health or mental health could exacerbate their IBD. 63% of people are concerned their medications would increase the risk of COVID-19. And there was another data that also showed that among those people who did confirm that there is a way to cope with COVID situation, as a high percentage of these people identified member associations. So patient associations as a channel, as a means to improve their life during the crisis, and also patient associations are recognized as a means to better cope with these challenges. So this is, I think, the most important feedback to us as representatives of member associations, as active people, as volunteers, as professionals in IBD community, to step up and develop and design more and more response programs to reach to those who are vulnerable and isolated and who need additional support to better cope with the COVID crisis. You must have seen on the internet the secure IBD and the COVID registry where data is collected from across world on patient outcomes for IBD patients infected with COVID-19. There you can also see some more detailed statistical information of different outcomes for COVID positive IBD patients. Can we go on? Okay, so I briefly mentioned this. We already held 2 patient talks as a short but dynamic discussions around hot topics related to COVID. We are hoping we will be holding more of these when September comes, so after the summer break, to also keep the pulse of what IBD community needs and what are the perceptions of various, let's call them stakeholders, but various entities within our community, and also to learn more what others are doing and try to identify those activities that could be stepped up or replicated as models of good practice. Let's go on. Questions. I think this was really quick. I think this is the end of my presentation here. What I have tried to do is to give you an overview of the EFCA work in the past year, and also some specific projects and interventions we carried out during the past year. I think, again, that COVID is a real challenge for us. I think we will need to, again, see how we cope with that and how we operate in future. But certainly we have an advantage and the strength of a network that builds on solidarity and on common experiences and common goals. And again, the youth group is really a part of that network, definitely, but it's also an EFCA strength, because young people are making the change are able to make this change, and young people in general have the potential to keep things going and look also further. So I finish here. I see some questions. I see a question from Amaranta. Hi, Amaranta. Nice to hear from you. You are asking me why it's important for young people to participate in EFCA. Well, I think in general, I think that a network is only as successful as its members really expect it to be. And I think that young people, again, bring this perspective that is really needed in a well-established network. So by participating in EFCA, I think you have access to experiences of other peers. So you can see what other what youth in other countries, in other contexts, in other locations are doing, how they are doing, what knowledges they have. And then I think it fertilizes also our personal knowledge. So when you think about EFCA, you think about a platform for exchange. And this exchange certainly can strengthen us. So I think that one of the largest advantages for you as young people is to look out for more experiences, for knowledge, for more information, and then empower yourself to participate and to be active. I hope this provides a response to Amaranta. One more thing, I think we need to investigate and to make use of our potential. So I think that the responsibility of the youth group is also to collect these, these proposals, these ideas, perceptions, individual positions, and kind of articulate them into a common message or priorities from young people who live with IBD towards EFCA, and then we can together work on these priorities. Selina is asking a question, what about the future beside COVID? I think that if you put COVID aside, I think our large so to say, priority or focus is to keep capacitating ourselves to be better informed, to have more skills, so as to grow into effective advocates for a better life, of better quality of life for people who live with IBD. I think another task for IBD community is to show that IBD is an illness that does not only affect your health status, that it affects your potential beyond that. So it affects your work, it affects your education. It also affects, in a way, how you contribute to yourself and to wider community, and it does affect your potential as an individual. If you see my points, I think we'll need to work more on shedding this light. EFCA has started this important work back in 2011, so almost 10 years ago, with an impact study that was exactly meant to show that more than health is affected by IBD. If you haven't, go to EFCA website and check this impact study, and you'll see all of the areas where people say, yes, this is important for me, and IBD is affecting me. So Selina, I hope this kind of shows what future we also see. Martin is asking, how does COVID impacted or will impact our work as patient representatives? I think that we need to find innovative ways to reach out and maintain communication with those individuals who are affected, and design programs that could, or scale up programs that could support IBD people. We know that because when we prepared for the second EFCA patient talks, we sent out an email and to our member association and asked about what associations are doing in terms of supporting during COVID, and there's a lot of it going on. There is really a lot of activities which are now taking place, but I think this issue of isolation is really important to tackle, also among young people, knowing that still there are people around the world who are being isolated or who are shielding because of IBD. So we need to reach out to them and kind of support them or include them in our communication and into our activities. And I think this discussion about what happens next and how we deal with the new normality or what happens after COVID will also be an important conversation to hold. Gabriela from Romania is asking about how to register for the future patient talks. Gabriela, I think you can simply keep an eye on the social media from EFCA, and there, as soon as we set this next event, whatever this event is, this will be announced through social media, and there's always information on how you register. Indeed, because this is online, you usually need to register so that you receive a link to connect to. So certainly this will be published. Just keep an eye on the media, I think on the Facebook primarily, and information will be distributed as soon as we know the event. I see a question from Reke. Is there any relative sitting in the board for youngsters? The way I understand your question, Rege, is whether a youth representative is sitting on the board. No, but I think Martin can provide a response to that. So I'll take one more question from Nimrod. I see a question from Nimrod, and then I kindly ask Martin to kind of maybe provide the answer to this if I understand well, or Rege would like to maybe explain a little bit about the question. Anyway, so to say to Nimrod, I have no idea. I don't know what the vaccine will be. We hope it will be there, it would be effective. We know that vaccines in general are effective to deal with epidemics. But certainly, and this is, I think, the official position of every patient community, they have to be reliable. They also have to be based on evidence, and they have to go through clinical trials. So I'm not an expert. I'm not a medical professional, so I cannot give you a medical expert opinion, but we are certainly hoping to see ways that will control this epidemic better, and that would then contribute to better quality of our lives, I think. Yeah, so I also see Martin has responded to Rege about the fact that youth group has a place on the EFCA board, but then Rege was thinking about whether people and relatives of those who have IBD can participate in the activities and on youth group board. I think that usually the youth group consists of young people with IBD. However, I think it's also important to recognize the support and help that is being provided to IBD people by their friends and relatives. So I think in the implementation of activities, we most certainly welcome anyone who is affected by IBD in any way. We see a lot of activism from mothers, from fathers, from parents in general, from caretakers of specifically young people with IBD. We see a lot of involvement from partners of people who live with IBD too, as well as other relatives and friends. And I think it also speaks to the true kind of scale of impact of IBD on young people. So I stop here. I will be with you until the end of this session, until the break. I will be here also if you have any questions. I forgot to mention in my introduction to apologize on behalf of Kira. Kira was unfortunately called for work because, and this is one other COVID, I think, influenced impact in a way. She had to work, so she couldn't participate today. We were supposed to do it in a duel, but she's sending her regards, and she was really sorry she couldn't attend. I hope I managed to transfer to you some of the information and the work on the work that EFKA has been doing. I stay here to answer any other question you may have. And also, as I was saying, as Kira and I were saying from before, EFKA board is there also to provide any support and help to the youth group in recognition of the fact that young people are the potential and the strength of our IBD community. So I stop here. I thank you all. I also thank you all for your questions. These are really some inspiring and challenging questions that you guys are posing. So thanks, and over to Martin.
Thank you very much, Marco. Thank you for your presentation. And we wish all the best for Chiara in this hard situation of hers. And to answer to Rika's question, of course, we don't discriminate people whether they have IBD or not. Anybody that is impacted by IBD can be part of the youth group, can be a delegate. It doesn't have to be the ill person. It can be a relative, of course. So it doesn't make any problem for us. And Antonella, if you can go back to the main presentation, so we can keep on with the meeting. And in the meantime, if you have any further questions about basically anything or reaction, feel free to share in the chat box. And again, we will collect the questions and reply at the end. Okay, so before the break, we can finish the presentation of the activity for the past years by presenting the iBridge project. So you have heard of it already about the transition project because we addressed it last year during the YM, and we talked about it quite a lot since then. So basically, this project is about it's focusing on the transition for pediatric to adult care and the challenges that it may cause to the young people with IBD that have to change hospital, have to change gastroenterologist. So this project has been running from 2017, so it's not exactly new. But what we did is to basically make it come to an end and conclude it by adding a communication strategy. So kind of a graphic visual identity that you can see on the right. So we created 2 logos to communicate on it. We came up with a name as well, so we can refer to the project with its proper name and graphic identity. We also used a survey that was done by the previous youth group in 2017 that was shared with the young people of Europe to see the challenges that they faces. So this report is available on the website, a dedicated website that we created, and this is the main milestone actually that we did. I think you can go to the next slide to present it. So this is just an overview of the main page of the website we created this year. So you have the link if you want to take a look and see the spirit. For now, it looks kind of sketchy because it's not totally finished yet, but the main idea is there. So basically what we did is to come up with information from the survey report first, but also from interviews. We did some interview with pediatricians, with professionals to share the ideas. We also connected with associations to have an idea of the main challenges and good practices that we can have during this transition period. And we divided the website into 4 main categories to target the different people. So the first one is the patient, of course, the patient that go through the transition. We have kind of a toolbox and good practices to follow to kind of ease and have a soft way of going through the transition. process, and afterwards there is also the doctors that are impacted. So we kind of sending advices to the doctors to ease the conversation and ease the process, so for the sake of the patient. And the third category that is impacted by this transition process is the family, so the relatives as a whole. So we also have a bit of advices for them, and eventually the association. So this is for you and I, the local association. What can we do, and examples of things that are already done to give kind of example of what is possible. So yeah, it's 4 categories with the same shape, providing kind of toolkit for the whole population that can be impacted. So this was done with the Eyg Bridge project for this year. So now I call the official closing of the project, because we will go on another project next year that we'll discuss soon after the break. If you have any remark, any reaction for this, you are free to share it again. You will have the link also communicated on our channels, so you can go take a look. And now, if you have any question, I give you the floor. And after that, I think it will be time for a small break. So go ahead in the chat box. Shoot. Hey, Dina. So thank you for your questions. Yeah, actually, once the website is all wrapped up and finished, we have the possibility to have the source code exported to other population, other association, to translate it in other languages. So we already have a demand from Spain, and we can, once we know that we can do it with Spain, of course, we can send you the source code and the material in Serbia and in every country to translate it, kind of like we did with the survey about education that I would talk later. But it's basically something that we do in English because it's the principal language, but then we can obviously translate it in any possible languages. Thank you. Thank you for that remark. Yeah, he took some brainstorm to come up with the name. I'm glad you like it. And the idea of having the bridge inside was really to, like we saw on the previous slides, on the logo, to have kind of a bridge from the child to the adult, what we call bridging the gap between the both population. And so the project was here to aim to facilitate this process between the two people. So it was really like a bridge to make an easier way to the final adulthood of the patient. Can we go back to the previous slide, please, Antonella, so they can... Yeah, so it's the picture you see on the top left. So this is a logo that was done by the user group that we came up basically during the meeting in Brussels. So when I told you it was a very important meeting, this is the kind of thing we do in a meeting midterm. It's all the things that we cannot do over the phone, basically. So it's also a huge time for us. Well, the website has been done by FK, so it's still editable. If we need to add anything, or as I told you, we will kind of reshape the pages. So everything is editable and we can make any change we want. So the idea now is we have it online, but the idea is to keep it alive and add materials, add recommendation if we need all the time, anytime we have one. But it's not something that is supposed to be left over on the sides and untouched. And well, the way we can help with that is to go have a look in the website. So we'll, as Amaranta is saying, we still have some things to fix. When it's done, you can go have a look and see and come back to us if you see anything missing, anything you'd like to add. It will be a pleasure for us to add anything that can make it more complete, of course. Okay, so Natasha, yeah, I get your question, and this is part of the minor thing that needs to get fixed. I guess the social media team will have responses for the Instagram account. But yeah, basically the idea is to have also the Facebook, Instagram account and the FK webpage linked to the website so we can connect from one to another. Okay, so I will take a few more questions if there's any. And Barbara, don't worry, the meeting is recorded, so you can see the replay afterward, and we can make you a debrief. It's not a problem. Just try to fix your connection. We will have a small break, and take time to fix your connection if you need. And Antonella, can you go to the next slide, please? And next again. Okay, so now it's 3:05, and we should go back around 20 past 3 to keep with the schedule. So what I suggest is that you take a 10-15 minute break. So we are 5 minutes behind schedule, so maybe you can come back at 20 past instead of 15, and then we can proceed with the election. So the room will be left open. So if you want to use the break to just chit chat with each other and try to connect, you can do that. But as I was saying at the beginning of the meeting, we will left also the room open at the very end of the meeting, so you can have a chat with each other. So now it's up to you. I will turn off my microphone and camera, but feel free to share anything on the chat box again, and we will collect everything during the break. And then we will proceed with the election and the workshop. Perfect. So now it's time for the elections. So we will give you a few minutes to vote afterward. But for now, I think Amaranta and Simo, if you are here, you can join on camera so we can have a quick presentation. And the way we are going to proceed is that you received a token, a private login by mail recently. We will also share in the chat box the link for the poll to vote. So Antonella, when you're ready, you can share the link. And so for this year, we have 2 positions to offer. And so Antonella just shared the link. And we have 2 candidates for those 2 positions. The first one is Amaranta that you saw earlier, and Simo. So they are both already in the board and they are standing for re-election. And basically on this link, you will have to click on yes, I accept them in the board, no, or abstention. So there is only 1 vote per country. So if you did not receive a token, it means that it's your fellow delegates that has it from the same country. So please connect to each other to make sure you have the right answer. And now I think we can give the floor to Amaranta so she can present herself a little bit.
Okay, so I go first. Hello everyone. I hope you can all hear me loud and clear. I am Amaranta. I'm 28. I'm from Spain. I joined this year because unfortunately Kathleen has to retire because of health issues. I want to thank her because every time I have doubts, she answers it, and I hope I'm helping to keep her legacy in the youth group. I stand for re-election because I had a very nice experience working with the youth group, and I believe I can help bring more new things to it. I have experience with a representation before, but not in patients side, in education stuff. And this one has been really fulfilling for me because this is like the first time I stand for something. I am also the person who is affected by it, and I hope I can help others with my job. And I also hope next year we have a physical AYM and you all come to Madrid like it was supposed to do, and we can all see each other in person. So that's it. And yeah, my picture is silly, but that was the one I had. Sorry. Yeah, I'm mostly used when I work.
That's always very cheerful. So thank you, Amaranta, for this quick presentation. We can have also the presentation of Simo, so you know both people you're voting for. Simo, the floor is yours.
Yeah, hi, I hope you can hear me. I had some problems with my mic, but I hope it's working again. I can see Marty smiling, so I think it's working. So I'm Simo, I'm from Finland, I'm 27, and I've been in the board like 2 years now. I'm mainly doing social media and working on the projects. And so far, I have loved it. I love working with these fellas, and I hope I can still keep going on, because I think that in the Europe, the youth, IPD youth still needs some improvements in life. And okay, I think I can send a text about this.
I think it will be easier for everyone. Thank you for your presentation. So Simo will send a text in the chat box. Just did. So now we will give you some time to go on the link, log in with your token, and click for either yes, no, abstention for both Amaranta and Simo. And when you are all done, we can continue with the education project and the workshop. So we can give you a few minutes. I will check up on you at 3:30 to see if everything is fine. And in the meantime, if you have any technical issues that you can't log in or things like this, you can reach out to the IT team on the chat box. So I just put again the link so you don't have to scroll all up. And the token you have received by email, the one with your name. You should have received it, I think, yesterday or 2 days ago. Does anybody have issues with the voting? Technical issues? Okay, good. I see a lot of votes done already. So Nimrod, we are taking care of your situation. I asked the IT team to send you the perfect the token again. So Mikele from the back office is looking into it. For the rest, is everything okay? Can you write in the chat box if you have not voted, if you need more time? Okay, so I think we can go on with the meeting if everybody has voted. Otherwise, just take a few minutes if you need, and tell me, Nimrod, as soon as we fixed your problem. Michele is looking into it. And you can vote in a few minutes. It's not a problem. The link won't close. Okay, so maybe we can go on with the education project to introduce it. So some of you may have already heard of it. We started to communicate on our new project. So this is a project that has been decided in January during the board meeting in Brussels, and that has been launched in end of May. So it's very recent, and it's the project we will focus on for the next year, and maybe the 2 next years. So it will be a great project, a huge project. And the first step of that project was to launch an online survey. So the first one was launched in English in the end of May for the General Assembly of EFCA. And since then, we had a tremendous response from all the delegates to translate the survey and diffuse it on their country. So I want to address a huge thanks to all the people that helped us with the survey, with the translation, with the communication. We had a lot of reply, very encouraging results. So we have 11 translations so far in just a couple of months, and over 300 responses already. So it's huge for us. It's more than expected, but we are just on the good slope. So we need to keep on the good work. All the survey will be open until the end of year, so you still have time to translate the survey if you want to help. We can add more translation and send reminders to add more responses as well. I think the results are very, very encouraging, and we need to have a great project to back it up, and not only a survey. So this is also why I will ask for your opinion and your input. And this is what we will do just now with the workshop. So the aim of the workshop will be to define the needs of the project. So for now, we just send out the survey with the questions about how the education has been done with IBD. So mostly in university and everything after high school. All the challenges or the drawback that the impact that IBD can have on the education course. But then we need material, we need outcome, we need to reach out to people, we need to be loud on it. So this is why we need your input on this. So we will have the workshop just now. If we can go to the next slide. . So the workshop will last about 1 hour. And will be divided in 3 different parts. So the first part will be what we can call state of the art. So basically identifying the problem. Why is it important to address it? And what problem there is exactly by using your personal experience, what you went through, and everything that can help us to really try to go around the whole problem and not forget anything, and try to identify the key points that needs to be treated. The second part will be about identifying the resources that we have available. So it can be material, it can be project that has been done by your association or another association. It can be the people to approach the decision maker, the one that holds the information that we can reach out to if you want to do interviews, anything like this. So the first one is about identifying the problem. The second one is identifying the resources. And the last and final one will be about the outcome that you want from the project. So basically how to have an impactful project, how to convince the important people, the decision maker, to follow our causes and to support this project. And what should we deliver at the end? What should be the outcome, and what is expected? What should be expected from us and from the user group as a whole? And yeah, basically, what do you expect from the project? So this is the 3 parts that you will have to talk about. You will be divided in 4 different groups. So this is what I sent you by mail, and that we should have on the next slides. If Antonella, you can go to the next one. So this is the group assignment for the workshop. Antonella, can you also share the link for the breakout rooms? So it's not the same links. Be careful, we had to change the links that you received by mail, unfortunately. So it will be new links that will be shared in the chat room. So you have it on the room. Your name should be on the slide. So just click on the link, and I strongly encourage you to connect with another browser to avoid technical issues. Usually you work better when you go with another browser. And so now I will leave you with Amaranta, Olga, Simo, Olga, Selina, and Natalia for the workshop. And they will be your facilitator. So I ask you to respect the instruction they will give you, to respect them, to respect the other people in your group, and avoid also side discussions about anything that doesn't concern the workshop and the assignment. As I said, we will have a breakout room at the end to just chit chat about anything. So it can be nice to be efficient in this and focus on the workshop. So myself, I will go from room to room to check in if everybody is okay. And if you have any technical issue for joining the room or anything like this, you can reach out to me or to the back office directly. So we are still here to avoid this kind of problem. So I give you a few minutes to go on with the workshop. Hopefully all the rooms are open and available. So I will check in a few minutes. And for the one that are still listening to me and are not in the workshop already, just go to your room and I will check in afterward. Good luck. Okay, so I hope everybody is here. I have a message from the back office that says that all the rooms are empty. So that means everybody should have joined back the main room. So before we close and we call it officially a night and we close officially the meeting, I would like to thank you, all of you, for being present and participating in the workshop. I heard some very nice idea from a few rooms, so we will go through everything and we will let you know. And don't forget that we are all connected together. We have a group chat. If you're not part of it already, you can send me ask me for an invitation, and I will add you. And then we will let you know everything that we are doing, and feel free to keep sending us notes and suggestions during the year. And Antonella, I think we can go to the next slide to conclude. So yeah, it's basically just a conclusion slide. I will now announce the results of the elections, the moment you are all been waiting for. So with 18 participants to the election and 17 approval, Amaranta is welcome again in the youth group. Congratulations, Amaranta. And with 16 approval, Simo is also welcome back in the
Martin, they can't hear you. Oh, I can't.
Okay, I will write it down in the chat. So everybody has the information. Amaranta and Simo. So, well, if you have technical issues now, it's not that you have a problem, because we will close the meeting. So again, thank you very much. Welcome back, Amaranta and Simo, and hope to see you next year face to face this time. I hope this crisis will be finally over. And a big thank you again, and feel free to contact us if you have any remarks, suggestions, or questions. We are still here to work all year long, so let's keep on with the good dynamic that we had lately. Thank you, all of you, and now I can leave the room open for a while. So if you want to connect with your camera and mic to just chit chat about the weather, or with just catching up about anything, please feel free. Bye bye.
Thank you, our leader, for everything.
And thank you, dear leader.
Dear leader.
Yeah.
And can you guys share your impressions about this kind of meeting, like in the box?
In the chat.
In the chat.
Martin, I don't know if Martin is here, but
Yeah.
can we take down the slide so we can switch cameras if we are seeing? Or
Hello, sorry, it's Antonella. Just to let you know, it's not possible to remove the default image, but if you click here, you can put it down, but you have to do it by yourself.
Oh,
so,
okay.
Okay, so now if everybody can
on the top right.
Yeah.
And so
just
if everybody switch on the camera, we can see everybody.
Exactly. Sorry for the intrusion. Goodbye.
Thank you, Antonella. And thank you also for the back office. Thank you for
being here.
Yeah, I didn't thank the back office, but you did a great job. So a huge thank for all of you. I hope everything went fine for everybody, even if we had some technical issues with some people at some point, which is normal. But thank you very much for the back office for doing a tremendous job as well.
I feel so much better with the camera. I don't know why.
Yeah,
because you love
it feels
yourself.
more personal.
It's because you look so pretty.
Come on.
Okay.
Well, thank you.
Are you wearing your pajama bottoms, or is like a full?
No, that's a full dress.
That's
with.
a dress. I
Oh,
saw on Instagram.
Yeah.
Great.
My bottom half is my pajama, so you know.
Yeah, don't worry, it's
webcam
okay.
life. I'm not worried at all. Okay, guys, if any of you want to connect with the camera and chat, it's perfectly fine. I mean, you don't have to leave if you don't. I mean,
don't be shy. Join us. Join us.
Antonella, can we stop the recording now, as the meeting is?
Yeah.
Meeting is over.
It's over.
Sorry.
So now you can insult.
You want us to stop the recording?
Yeah, if we can stop the recording.
Okay. Okay.